I think this could be an absolute game changer. This isn't a Scottish Conservative bill, it's not my bill, I'm the MSP taking it forward, but it's been developed and written largely by frontline experts, people who are at the coalface, who have been helping those addicted to drugs and alcohol for many years, and they think this bill could make a big difference by enshrining in law that legal right for people to get the recovery, treatment and services they need to overcome their addiction. Well, I think there's been 3 drugs ministers during the time. Angela Constance was very supportive in terms of her engagement. She decided not to take on the bill as a Scottish Government bill, but encouraged me to continue as a private member's bill. Eleanor Witham was also involved, and just last week I was speaking to Christina McKelvey about it. So I do hope, and I get the feeling there is a keenness to engage, to look at the contents of the bill and to look at what we can do to get the support across Parliament to bring this forward and get it into law. Already we've got more than one party supporting it. You need that for a non-government bill to be allowed introduction into Parliament. So we've got to that stage. Now we need to reach out to all MSPs to look at the situation in their local area and across the country. And in every part of Scotland we are seeing far too many lives lost due to addictions to drug and alcohol. This bill could make a difference all across the country. Well, we know previous Scottish governments took away funding for rehab facilities. We saw the number of beds drop. There's a commitment to increase the beds up again, although the progress towards that commitment is not as good as it should be at this stage. It will require more investment. The financial memorandum that accompanies this bill suggests anywhere between 28.5 million and 38 million of additional funding annually. Now, that is a lot of money, but we have a lot of people dying. We have a lot of lives being lost and families torn apart mourning the loss of a loved one. So we do need to invest, but also we know from studies elsewhere that investing in these treatment and recovery services now can save the government significantly more in the long term in terms of justice funding, health funding and for the wider economy. So I think it's absolutely right that we're honest and we're upfront. This bill will cost money, but ultimately it will also save lives.